Welcome back to the second day of pre-licensing today. We have 3 session hours, and we will be starting with the Affordable Care Act for Navigators and CACs with Shelly and Sharone from OCI back with us again today. Shelly and Sharone, if you want to go ahead, I will get your slides up for you.
Thanks, Elizabeth. Hello again. Good morning. This is Shelly. I'll wait for the slides to come up and then we'll get the ball rolling. All right. So, next slide, please. The Office of the Commissioner of Insurance's mission statement provides the context in which OCI goals and strategies are formulated. It depicts the scope and direction for the agency and provides the framework within which all decisions will be made regarding programs, proposed legislation, rules, and administrative goals. OCI's mission statement was updated in 2021 to reflect the modern industry and the current goals of the office. The mission statement is core to OCI's operations. Next slide, please. The definition of a navigator is that of an individual or an entity that supervises or employs an individual who either performs any activities and duties related to the Navigator program on behalf of the Federal Exchange and who receives funding to perform such functions on behalf of the Federal Exchange. An individual navigator does not include a person acting as an insurance intermediary. We will dive into the specific licensing requirements for a navigator and certified applicant counselor in the next few slides. Next slide, please. A certified application counselor, also known as a CAC, is a non-navigator assister who has been designated by or working on behalf of the Federal Exchange. Along with any federal training requirements, CACs are required to meet the training and examination requirements established for navigators, including the 16 hours of pre-licensing training and successful passage of the written examination. Once the requirements are met, a CAC is not licensed by OCI, but a certification form must be submitted by the organization the CAC is working for. Next slide, please. This is how the landing page looks on the OCI website for information about navigators. By clicking on the plus signs located towards the bottom of this page, drop-downs open and information is provided about the requirements needed prior to the exam, any study material for the examination, and links to sign up for the exam and fingerprinting, FAQs, and other important and helpful information. This will be your go-to page for information and procedures about becoming a licensed navigator. Next slide, please. So here are the 7 base requirements to become a licensed navigator. You must be 18 years of age, a resident of Wisconsin, completion of the pre-licensing training such as this, completion of federal training requirements, pass the written exam, provide fingerprinting in the background check, and be affiliated with a navigator entity. Any pre-licensing training such as this ensures a uniform basic knowledge for those assisting consumers. Next slide, please. All right, so we've come to our first polling slide question already this morning. So which of the following is not a navigator licensing requirement? A, be fingerprinted and receive a background check. B, be appointed with an insurance company. C, be a resident of Wisconsin. Or D, be affiliated with a navigator entity. We'll give you about 10 seconds here. Okay, so the answer is B, be appointed with an insurance company. Next slide, please. Agents that hold an active intermediary license with the Accident and Health Line of Authority and complete the Wisconsin and federal training to be a navigator may apply to be licensed as a navigator. However, an agent cannot have any active company appointments with a health insurance company and cannot receive commission from the health insurance company to act as a navigator. Agents must be certified by the Federal Exchange as a navigator and be affiliated with one of the entities that receive a federal navigator grant. Next slide, please. So here are the initial requirements a navigator needs in order to become licensed in the state of Wisconsin. As I give you a moment to review these requirements, I remind you all again that this information can be found on our website to with links to sign up for the exam, submit it the fingerprinting, and to also to submit the electronic application. Next slide, please. Here are the requirements for a navigator to renew their license. If a license is revoked for failing to pay fees or not obtaining the continuing education credits, there is the ability to regain the license by completing all of the requirements noted in this slide. Next slide, please. So this is how the landing page looks on the OCI website for information about CACs. Again, by clicking on the plus signs towards the bottom of this page, drop downs open up and information is provided just like the navigator page about the need for the requirements prior to the exam. The study materials for the exam, any links to sign up for the exam and the fingerprinting, FAQs, and other important and helpful information. Next slide, please. Individuals working in settings such as federally qualified health centers, hospitals, healthcare providers, social service agencies, local health departments, and Indian Health Services who do the following must be registered with OCI. They are defined as those who help consumers fill out electronic and paper applications to establish eligibility for the Federal Exchange and Public Assistance programs, and those who help consumers enroll in coverage on the Federal Exchange. A certified application counselor is asked to complete the same initial pre-licensing requirements as a navigator, including the 16 hours of pre-licensing training and successful passage of the written exam. These requirements are in addition to any federal training requirements. Entities employing one or more non-navigator assisters are required to provide the Commissioner with a list of all CACs that it employs, supervises, or is affiliated with once the individuals are authorized by the Federal Exchange to provide that assistance. Entities employing, supervising, or affiliated with CACs assume legal responsibility for the acts of those CACs. Next slide, please. Although similar in base knowledge requirements, CACs are held to a different standard than navigators, but are still expected to be neutral and informed in order to provide a consumer with the best possible experience in choosing their health care. Next slide, please. Enrollment into a qualified health plan on the Federal Exchange. Navigators and CACs can refer consumers to insurers or licensed agents if consumers are interested in products off the Federal Exchange. These will be without advanced premium tax credits or assistance, but they may be more affordable for persons who are not income eligible for the perks on the marketplace. Permitted activities are conducting public education activities to raise awareness of qualified health plans within the federal market, distribute fair and impartial information concerning enrollment into a QHP through the Federal Exchange, and the availability of premium tax credits and cost sharing reductions that may be available, Explain that consumers may purchase health plans through the federal exchange or off the exchange. Make consumers aware that plans are available in the outside market and that they must talk to a licensed health insurance agent about other health insurance options. Facilitate enrollment into a QHP through the federal exchange. Outline information that a consumer will need to have available when applying for coverage through the federal exchange. Providing that information will allow the consumer to access the exchange either at their home or computer terminal provided by the Navigator. Explain to consumers the following information: their potential eligibility for public governmental programs, how the health insurance premium tax credit works, and cost sharing reductions work and their risks of those, if any, for the use of the premium tax credit. Describe the features and benefits of health coverage in general terms, including cost-sharing mechanisms like deductibles, co-pays, or coinsurance, and how these work or affect the consumer, and what a summary of benefits document is, where to locate that document, and relevant cost-sharing provisions within the information from QHPs. Explain how to find the information about provider networks and describe the different metal tiers and how the benefits may change at different metal tiers based on the consumer's income. Lastly, provide a referral for an individual to an appropriate state or federal agency who has a grievance, complaint, or question regarding their health plan, coverage, or a determination under such plan or coverage. Next slide, please. Navigators are to be a neutral provider of information. They are a valued resource in a complex field. Neutrality is that key. The hope is to guide or navigate health insurance terms, networks, cost, and a guide for a consumer so that they can make an informed decision on health insurance, balancing affordability and their tolerance for risk. Some prohibited activities are receiving compensation from an insurer, stop-loss carrier, or a third-party administrator, provide any information related to enrollment or insurance products not offered in the federal exchange, make a cause or to make false or misleading statements, provide advice comparing health benefit plans that may be better or for worse for the customer or the employer, recommend a particular health benefit plan or insurer, or advise consumers or employers regarding a particular health insurance benefit plan, recommend a particular health plan or insurer, and engage in any fraudulent, deceptive, or dishonest acts or unfair methods of competition. Any individual or entity acting in violation of the laws may be subject to an administrative action, including restitution and limitation, or revocation of licensure or registration. All licensees need to comply with the post-breach notification requirements unless they are subject to HIPAA. Next slide, please. Here is a breakdown of the Navigator exam. This slide provides you with a line-by-line comparison of what sections the questions for the exam derive from. These are the areas of content that you'll need to focus on. There will not be questions on the exam, for example, like the history of health insurance, as they are not relevant. OCI expects all individuals who are guiding and assisting Wisconsin consumers on complex matters of health insurance to understand this material and provide the best support possible to those they are helping, as that is what they expect from you. The exam content outline can be found on our website under the Agent Exam Requirements page. Next slide, please. So this again is just a summary of the information a candidate can find on our website surrounding the requirements needed and how to register for the exam. Next slide, please. The ACA open enrollment is the period of time when a plan can be purchased or changes and updates can be made to an existing ACA plan for the upcoming year, as we touched on yesterday. Currently for 2026, the open enrollment period stems from November 1st through January 15th of 2026. Any plans sold during that open enrollment period would have an effective date of January 1 if purchased before December 15th, and any plans sold after December 15th would have an effective date of January 1st. Next slide, please. A special enrollment period, or SEP, is the time outside of the yearly open enrollment period when you can sign up for health insurance. A consumer may qualify for an SEP if they have had certain life events, including losing health coverage, moving, getting married, having a baby, or adopting a child. Depending on the special enrollment period type, a consumer may have 60 days before or 60 days following the qualified event to enroll in a plan. Next slide, please. So we've come to our second polling question. Special enrollment periods are available for individuals when they are no longer eligible for Medicaid, receive a promotion at work, find an insurance plan that they like better, or want to change their primary care doctor. I'll give you about 10 seconds here to pop in your answer. And on this one, the answer is A. They are no longer eligible for Medicaid. Next slide, please. Wisconsin has a competitive individual health market with currently 12 insurers offering plans on exchange in 2026. Those on-exchange insurers must also offer their plans off exchange as well. Located on this slide is the link to our website where you can specifically narrow down by county those plans that are available. We often, the interactive map provides the critical information and links to companies that again offer that specific coverage in the county being looked at. Next slide, please. We talked yesterday about the requirements around insurance contracts. So just to recap, the laws and regulations apply to all insurance policies delivered or issued for delivery in this state. An insurance company has been notified if the company's authorized agent has been notified by or on behalf of the policyholder and provided with sufficient information to identify the policy in question. Every insurer is bound by an act of its agents performed in Wisconsin that is within the scope of the agent's authority. Insurance coverage is issued based on the applicant's requirements and representations. Representations are oral or written statements made by an applicant. Wisconsin consumers are provided with privacy protection for medical and financial information, and insurers are required to notify their insureds of the right to file a complaint with our office regarding problems they may have with their insurance. The notice is required once for each policy or certificate issued by an insurer. Next slide, please. So again, just continuing with the insurance contracts, we've talked about notice of claim. Within the proof of loss, is to be furnished by an insurer as soon as reasonably possible and within 1 year after the time it was required by the policy. For prompt settlement, unless otherwise provided by Wisconsin law, subject to interest payments, an insurer must promptly pay most insurance claims within 30 days. For a mistake in the insurance contract, any of the following without just cause and such regularity constitute an unfair claims method practice: the failure to promptly acknowledge pertinent information and communications, the failure to promptly provide the necessary claim forms or instructions to an insured or claimant, the failure to attempt in good faith to effectuate fair and equitable settlements of claims, and knowingly misrepresenting to claimants pertinent facts or policy provisions. Again, there is the right to return a policy. For health insurance, you have 10 days. And if there is, excuse me, and if the policy is returned within the 10 days, that insurance contract is invalid and all payments made under the contract must be refunded. The right to return a policy must be printed on or attached to the first page of the policy. And for grace periods, again, as we talked on yesterday, for health insurance, there is either 7 days a grace period for weekly premium policies, 10 days for monthly, but not less than 31 for all others. But obviously, that is subject to any kind of premium tax credits a consumer may receive from their marketplace plan. Lastly, if you disagree with an insurer's determination, you have the right to appeal through a grievance. It's the dissatisfaction with an insurer offering a health plan. All insurers that issue health benefit plans must develop an internal grievance process. The independent review process is which an outside expert provides a second look at a benefit determination. This process provides an insured with an opportunity to have medical professionals who have no connection to their health plan review the dispute. The IRO assigns the dispute to a clinical peer reviewer who is an expert in the treatment of the disputed determination. The IRO has the authority to determine whether the treatment should be covered by the health plan, and the reviewer is not affiliated with the insured, the medical provider, or the insured and conducts an independent and unbiased review of that claim. Next slide, please. As we talked about, the definition of risk relating to insurance is the uncertainty of a financial loss. The tolerance is the amount of risk one is willing or wanting to take on by themselves or can afford to take on. Insurance is defined as a transference of risk. You will often see lower premiums with group products. The reason for this is the law of large numbers or pooling of risks. The basic elements of a contract are an offer of it coverage, acceptance of the coverage, consideration, also known as the money, and in the intention to create a legal relationship. Next slide, please. Long before the ACA and HIPAA, Wisconsin was a leader in consumer protections. The next couple of slides discuss the mandated benefits that must be offered by health insurers to Wisconsin consumers. Here is a brief overview of each of these benefits. Disabled children. Health insurance covering dependent children must provide coverage beyond age 26 while the child is primarily dependent on the insured for support and maintenance. Insurers can require proof of the child's disability. For home health care, this provides coverage for the usual and customary fees for at least 40 home health care visits per year. Home health care may include intermittent home nursing care, home health aid services, various types of therapy, medical supplies, and medication prescribed under the home health care. For skilled nursing care, health insurance covering hospital expenses must cover at least 30 days of skilled nursing care to patients who enter a licensed facility within 24 hours after discharge from a hospital. Coverage may be limited to care that is medically necessary as certified by the attending physician. For kidney disease and transplants, insurance covering hospital expenses must provide inpatient and outpatient treatment of kidney disease, including dialysis, transplantation, and donor-related services. Coverage for newborns. Health insurance must provide coverage from the moment of birth for a newborn of the insured. The newborn shall receive the same coverage the policy provides for any children covered or eligible for coverage under the policy. Policies, however, may require notification of the child's birth and payment of any additional premium within 60 days of the birth. Adopted children. A health insurance policy covering dependent children must cover adopted children and children placed for adoption by the same terms and conditions as any other children. Coverage for grandchildren. Health insurance providing coverage for any child of the insured shall provide the same coverage for all children of that child until that child reaches the age of 18. Diabetic supplies and equipment. Health insurance covers expenses for the treatment of diabetes, shall provide coverage also for insulin fusion pumps, other equipment and supplies, insulin, other prescription medication, and diabetic self-management education programs. Insurers may apply the same exclusions, limitations, and coinsurance provisions applying to any other covered expenses. Maternity benefits. If a group health policy provides maternity coverage for anyone covered under the policy, it must provide coverage for all persons covered under the policy. Mammograms. Women who are age 50 to 65 must be covered for annual mammograms, and women between 45 and 49 with 2 examinations by low dose mammography. Coverage is required regardless of whether the woman has shown any symptoms. And lastly, HIV. Any health insurance providing coverage of prescription medication shall provide coverage for each FDA-approved drug prescribed by the insured's physician for the treatment of HIV infection or an illness or medical condition arising from or related to an HIV infection, subject to any deductibles or copayments that would generally apply to any other prescriptions. Next slide, please. For hearing aids, this is required to provide coverage for hearing aids, cochlear implants, and any related treatment prescribed by a physician or licensed audiologist for children under 18 years of age, and the child must be certified as being deaf or hearing impaired. This is also subject to any cost provisions. Contraceptives are required to provide coverage for contraceptives prescribed by a healthcare provider. For cancer clinicals, health insurance is required to provide coverage of routine medical services for the treatment of cancer provided to an insured in a cancer clinical trial if the services would have been covered under the policy if the insured were not enrolled in the cancer trial. However, insurance is not required to cover the cost of the treatment or the drug the trial is studying. For dependents, health insurance covering dependent children must provide coverage to an adult child of the applicant or the insured if the child is under age 26. For mental health, health insurance providing coverage for inpatient hospital treatment or outpatient treatment must provide coverage of inpatient hospital services, outpatient services, and transitional treatment arrangements for the treatment of nervous and mental disorders and substance use disorders. Coverage cannot be more restrictive for coverage of the treatment of mental health disorders or substance abuse disorder conditions than the most common or frequent type of treatment limitations applied to substantially all other coverage under the plan. Lead poisoning is required to provide coverage for blood tests for children under the age of 6 according to the screening protocols established by the Department of Health Services. For TMJ, a policy providing coverage for any diagnostic or surgical procedure involving a bone, joint, muscle, or tissue are required to provide coverage for diagnostic procedures and medically necessary surgical or non-surgical treatment for the correction of TMJ disorders. For breast reconstruction, insurance providing coverage for a mastectomy is also required to provide coverage of breast reconstruction of the affected tissue incident to a mastectomy. Dental care. It is required to provide coverage for charges incurred and anesthetics provided in conjunction with dental care for a child under the age of 5, an individual who has a chronic disability, or an individual who has a medical condition requiring hospitalization or general anesthesia for dental care. Immunizations for children. It must provide coverage for a dependent of an insured for appropriate and medically necessary immunizations for children under the age of 6. The coverage may not be subject to any deductibles, copays, or coinsurance under the policy and plan. Autism. Coverage is required for the treatment of autism spectrum disorders, which include autism disorder, Asperger's syndrome, and pervasive developmental disorders not otherwise specified. Coverage must be provided for an evidence-based treatment of autism spectrum disorders if the treatment is prescribed by a physician or provided by qualified providers. And lastly, student on medical leave. Health insurance providing coverage for a person as a dependent of the insured because the person is a full-time student shall continue to provide dependent coverage for the person if, due to medically necessary leave of absence, he or she ceases to be a full-time student. Next slide, please. And now I will pass this on to Sharone. Thank you.
Thank you, Shelly. I will move us on to contingent mandated benefits. Excuse me. What we mean by contingent is the mandate sets up an if-then requirement. Prescription eye drops. Every health insurance policy that provides coverage of prescription eye drops shall cover a refill of the prescription eye drops if the requested refill does not exceed the number of refills allowed by the prescription. Oral chemotherapy. Health insurance covering injected or intravenous chemotherapy and oral chemotherapy is prohibited from requiring a higher copayment, deductible, or coinsurance amount for the oral chemotherapy than is required for injected or intravenous. Colorectal cancer. Health insurance covering any diagnostic or surgical procedures is required to cover colorectal cancer examinations and lab tests for any insured who is 50 years of age or older, or any insured who is under 50 years of age and is at a high risk for colorectal cancer. Chiropractic, nurse practitioners, and optometrists are required coverage based on services covered. The insured cannot discriminate what services the provider is offering so long as acting within the scope of their license. So, for example, a chiropractor should not be administering an eye exam to their patient unless they are licensed to do so. Next slide, please. Now we'll move on to marketing practices. Here are some of the key practices our office monitors. We got into this a little bit yesterday. Advertising. An advertisement should not exaggerate a benefit and shall be sufficiently complete and clear to avoid deception or the tendency to mislead or deceive. You need to avoid providing your opinions on companies or products. Instead, educate the consumer so they can make the best decision possible for themselves and their family. Unfair marketing practices. We touched on examples of these practices in our previous presentation. Unfair marketing practices include the following listed on the screen. Next slide, please. And now we have our third polling slide. The following are examples of unfair marketing practices. A, misrepresentation. B, unfair inducements. C, undue influence. Or D, all of the above. I'll give it a moment. And the answer is D, all of the above. These are all defined by statute and or rule as unfair marketing practices. Next slide, please. An agent or insurer must ask such questions as are necessary to determine that the purchase of insurance is suitable for the prospective buyer. This is an area where we can see a lot of complaints against agents, especially when it comes to dealing with the senior population. Make sure to take as much time as needed to ensure that the person you are talking to understands in full detail what is being offered to them. Per state law, an insurer is responsible for the acts of appointed agents when it comes to marketing, selling, and servicing their products. So, for example, we had a complaint once where the consumer provided written notice to their agent to cancel their policy, and the agent didn't follow through on sending that notice to the company. This wasn't discovered until months later. Normally, the company would not have honored that request, but because their agent had it and did not act in an appropriate time frame, they were required by statute to backdate the cancellation. Next slide, please. Short-term limited duration. Short-term limited duration plans are not required to include specific ACA consumer protections. Some consumers may believe that ACA compliant plans are priced to include unwanted benefits. Short-term limited duration plans may offer premiums that are lower than unsubsidized premiums for ACA compliant policies, but the flip side is they expose enrolled members to additional healthcare costs in the form of cost sharing and non-covered services. Price-sensitive consumers lacking full information about available ACA subsidies may gravitate towards enrolling in low-premium short-term limited duration plans, despite their limited coverage protection and high out-of-pocket costs. In some cases, short-term limited duration plans may not actually be the lowest cost option. For example, if the consumer is eligible for federal premium tax credits. Additionally, marketing short-term limited duration may sometimes be confusing or misleading. Short-term plans that are marketed as alternatives to comprehensive individual coverage we would consider that to be potentially misleadingly marketed. If OCI finds that an insurer or agent represents a short-term plan as compliant with the ACA or providing more than bridge coverage or short-term coverage, OCI may consider this an unfair marketing practice. Next slide, please. As we discussed yesterday, healthcare sharing ministries are not insurance. Healthcare sharing ministries are non-insurance entities in which members share a common set of ethical or religious beliefs, in theory, and share medical expenses among members in accordance with these beliefs. Next slide, please. Federal health insurance exchanges. There are currently 23 states and the District of Columbia that have their own ACA state-based exchanges, but Wisconsin is not one of them. So we still use healthcare.gov. Minnesota is the closest state-based exchange, so just be aware where your clients are residing. Next slide, please. Under the ACA, an insurance plan sold on a health insurance exchange marketplace must be certified by the marketplace, and once certified, it becomes a qualified health plan, or QHP. QHPs provide essential health benefits, follow established limits on cost sharing, and meet other requirements. All qualified health plans meet the ACA requirement for having health coverage, known as minimum essential coverage. Next slide, please. The ACA requires that all Americans have health insurance that qualifies as minimum essential coverage. Technically, that law is still on the books, even though, as you may know, it is the penalty for not having minimum essential coverage is no longer on the books. Comprehensive individual and small group health plans, most employer-sponsored plans, and governmental plans such as Medicare all qualify as minimum essential coverage. Short-term health policies and limited benefit plans, such as fixed indemnity, critical illness, those are not considered minimum essential coverage. Next slide, please. Essential health benefits are a set of healthcare service categories that must be covered by all comprehensive individual and small group health plans, subject to the ACA. Essential health benefits must include items and services within at least the following 10 categories listed on this slide. EHBs also include all the Wisconsin mandated benefits that we talked about a few slides ago. The ACA provides that each state establishes an essential health benefit benchmark package to serve as the minimum standard for plans required to offer EHBs. Wisconsin's plan is called the Wisconsin EHB Benchmark Plan. Next slide, please. The ACA provides a federal tax credit to help individuals and families afford health coverage purchased through the health insurance exchange. The premium tax credit can be taken in advance to offset the monthly insurance premium or in the form of a refund at the end of the year. Cost sharing reduction is a type of financial assistance available under the ACA. It is based on an individual's income and paid directly to the insurance company. It helps to lower the amount individuals will have to pay for out of pocket for deductibles, coinsurance, and copayments. But note, the cost sharing reduction is only available through the health insurance exchange for individuals with incomes below certain levels and who choose a health plan from the silver medal tier. Next slide, please. After entering in the information about an individual or a family, the healthcare.gov website will assist you in the next steps. If the system detects a person may be eligible for Medicaid, it will forward their information to that state agency for them to contact the consumer. And it will also determine where a consumer is eligible for cost sharing reductions or advanced premium tax credit. Next slide, please. As we have previously talked about, the ACA provides a federal tax credit to help individuals and families afford health coverage purchased through the health insurance exchange. Cost sharing reduction is a type of financial assistance available under the ACA. Wisconsin insurers also offer plans off the federal exchange. These may have similar coverage and can be less costly. Next slide, please. As previously stated, a contract between a health insurance company and a consumer is where the company agrees to provide coverage applicable under the terms of the policy in exchange for premiums paid. Make sure you understand frequent terms used relating to health insurance policies, such as deductibles, coinsurance, copayments. Next slide, please. Cost sharing is a term used in health insurance, so it's important to understand and to be able to explain the 3 out-of-pocket possibilities for a member that fall under the term cost sharing. Coinsurance is the percent of a billed service that the insured will be responsible for paying. Copayment is a set or flat fee that the insured will be required to pay. It's usually for office visits. And the deductible is the fixed dollar amount that the insured must pay before the insurance policy starts to pay for covered services. Next slide, please. Understanding the concepts of cost sharing is key to balancing affordability of the premiums with overall out-of-pocket expenses for the consumer. Next slide, please. As we've touched on previously, HMOs offer the least flexibility, but usually have the lowest monthly costs. EPOs are a bit more flexible, but usually cost more than HMOs. PPOs, preferred provider organizations, offer the most flexibility, but typically can be the most expensive. Next slide, please. To control the cost of prescription medications, the Wisconsin legislature passed a law in March 2021 requiring pharmacy benefit managers to be licensed and regulated by OCI. The goal of the oversight is to increase transparency, control costs, and protect consumers. Pharmacy benefit managers increase patients' access to medications by negotiating directly with manufacturers and wholesalers. Next slide, please. These are the provisions often overlooked by consumers most frequently because they do not think such issues or sets of circumstances will happen to them or their family. Exclusions can also occur when a company feels a treatment or therapy is not medically necessary. As we've mentioned before, OCI generally cannot make determinations of the necessity of a treatment. Next slide, please. We touched on the summary of benefits already. This sample can be found on the healthcare.gov website, and this is just a brief snapshot of a plan's important features. Next slide, please. Next slide. And next slide. And next slide, please. Polling slide number 4. Which of the following should be considered when selecting a health insurance plan? A, premium. B, cost sharing. C, network and coverage. D, all of the above. And the answer, as you might expect, is all of the above. Next slide, please. A consumer might benefit from a refresher on some of the elements of commercial insurance plan design, such as premiums, cost sharing, and differences in benefits and provider networks. Some individuals may think of reviewing the provider directories or search tools of marketplace plans before enrolling to ensure that important providers are in network. As a navigator, you are trained to assist consumers to look at all their healthcare options through the marketplace, which includes conveying accurate, unbiased information so consumers can make informed decisions. This also includes completing eligibility and enrollment forms. Taking the time to educate and raise awareness about the Federal Exchange is vital to being successful every day in your role as a navigator. Next slide, please. And now we've come to the end of our presentation. Thank you for having us provide this information, and we wish you best of luck in the future.
Thank you, Shelly and Sharone. If we want to go ahead and look through that Q&A to see what answers we might be able to answer today, or any questions that we could take back and have answered later. So for one question, it states, if patients enroll in a plan during open enrollment prior to ATPCs expiring on 12/31/25, will their premiums change, or will they remain the same until the plan terms or renews? I don't know, Shelly or Sharone, if you want to answer that. Otherwise, we could have Adam answer that as well.
I think it'd probably be best for Adam to answer that one if he could, please.
Absolutely.
Okay.
Yeah, I'd be happy to.
Thank you.
I think I understand the question. So if somebody enrolls in the plan during OE, we could look at it a couple different ways. So say they enroll in a plan for this year before, the end of the calendar year. Regardless of any other circumstances, the premiums are going to change when the new year rolls around. That's when the plan terms renews. They always change at the start of the calendar year. Similarly, they might change anytime somebody updates their income information or changes county, anything like that. The plan could change as well. But to the point of the question, they're going to remain the same for the calendar year, or until they make a change, or until the new new year hits and the new plan year starts. Hopefully
Thank you,
that
Adam.
covered it. I added some context to hopefully make it work for everybody, but hopefully that was good enough.
And if there's a follow-up question, you guys are more than welcome to put that in there, in case Adam can be, have more context if you're interested. We also have another question that says, are insurers from the marketplace required to keep provider directories up to date?
And the answer to that one is yes. They are required legally to verify and update their provider directories at least every 90 days. Obviously, it could be a situation where if a provider chooses to leave a network and we're 25 days into the last check, it may not be updated then for another, we'll just say 50 to 80 days. But yes, according to the marketplace, they are legally required to update that.
Thank you, Shelly.
Yep.
If there are any other questions, please feel free to put them into the Q&A. We'll give that another minute or so. Adam, do you want to follow up with the other question that was just put in?
Yeah, I'm reading it. I'm kicking it around the old dome here, trying to come up with it. So the question is, but all the premium tax credits will go away once they expire at the end of the year. So all plans will go to full price. The premium tax credits don't necessarily expire. I think that might be the wrong way to look at it. There are certainly some rules you'll hear about during the conference about things going on with APTCs. But if somebody is auto-renewed into a plan, they will still have PTCs applied. They might not be right if that happens. But if somebody does nothing, there's a good chance they'll be auto-renewed, at least in the current present. But yeah, so the PTCs don't necessarily go away. They'll just kind of switch to the new plan. So I wouldn't say they would go full price.
Can I jump in? Oh,
yeah, go ahead.
Sorry. I wonder if this question is a response to the expiration of the enhanced advanced premium tax credits.
Yeah, I think that, Sharone, I think you could be right about that. So that's something I actually cleared up during a media interview. So I'll be happy to say. The enhanced premium tax credits, there's certainly a lot of debate around them right now. People have a lot to say, different support for continuing them. So that might still happen. But either way, if they go away, there will still be tax credits. They will be less because the enhancements were generous and allowed for higher tax credits, but there will still be tax credits. That is baked into the ACA and the marketplace.
And also, the open enrollment will don't want to misspeak, so Adam, please correct me. But my understanding is, at least in prior years, healthcare.gov would have like the tech mechanism to reflect the like the premium that the consumer would see, like sort of in real time, taking into account advanced premium tax credits. In which case, that's not going to change. It's reflecting plan year 2026, and it will continue to do so. So it's not as if some change between 2025 and 2026 is going to result in like misleading or incorrect information on healthcare.gov for plan year 2026.
Right.
If that makes
Yeah.
sense.
No, yeah, that's absolutely right. You can trust what you see in the application. To a lesser extent, you can mostly trust what you see in the plan preview tool. But that's the number that, like you said, it's going to have the tax credit applied to it. Only by selecting you don't want to see the extra savings, or by basically pricing yourself out with your information, will you see a plan without a tax credit applied?
Great, thank you. All right, if there are any other questions, please feel free to go ahead and submit them while we still have Shelly and Sharone on.
Oh, is the question, I see a question, is every state different when it comes to applying? I assume you mean applying for, like, oh, so essentially, a state will either have a state-based exchange, which Wisconsin doesn't, or the residents in that state will use healthcare.gov. So I'm not quite sure what you mean by every state different. There are rules that apply across the board to state-based exchanges. So in some respects, you're going to see similarities, like generally speaking. Maybe if you can provide more specifics about what you're asking about every state being different, I could provide more context. I guess I'm still not quite sure, but I'll just say, okay, so in Wisconsin, if you're looking for ACA coverage, then you'll be looking on healthcare.gov. Other states, it's going to depend on whether the state is running its own exchange or not. And then states are also going to differ depending on, I'm not sure if this is your question, whether they've expanded Medicaid or not. So I guess it's just going to kind of depend. But if we're talking about the ACA getting QHPs, it's either going to be through a state-run exchange or healthcare.gov.
And I'd like to add, Sharone, too, if I could, that, please be aware that Minnesota currently does have a state-based exchange, and Illinois is going to have a state-based exchange come Jan 1 of 2026. So there are surrounding states. So just, make sure that whoever you're enrolling understands the possibilities out there, and that you also understand the state that they're residing in, so that you don't submit an application for the wrong type of exchange, for lack of a better term.
Yeah, and my understanding is it's pretty hard to like there's a lot of instances of misrepresentation and fraud that we're currently hearing about, but I think it's pretty hard to in good faith sign up incorrectly. A consumer will be directed to a state-based exchange if they're on healthcare.gov, but they live in Minnesota, Massachusetts, whatever it is that's running their own state-based exchange. If they're living in Wisconsin, a state-based exchange is going to clearly indicate that they're from that state. There's not going to be that much confusion. It'll be pretty hard for a Wisconsin resident to sign up in Minnesota and not realize they're doing so. They're just going to be directed to healthcare.gov if they're a Wisconsin resident.
Thank you. We will give it another minute if there are any other questions that might be rolling in. And if you find that you have questions later, you can always email us at coveringwi@cwi.wisc.edu, and I can get those questions over to Shelly and Sharone as well.
Also, Elizabeth, I was going to say, I think a couple of these where there are questions asked successively, as part of a continuing thought process, great for office hours, right? We have that office hour session at the end of the conference where we can have that whole conversation. Happy to do it there.
Yes. Yep. Absolutely. And we'll put that link in the chat again today and tomorrow for the office hour that we will be hosting, Adam and I. And next, Adam will be going through a healthcare.gov application. And we will be covering special enrollment periods as well after we take a short break until 9:50. So thank you again to Shelly and Sharone for joining us the last 2 days. I very much appreciate it. And we will see everyone again at 9:50.